Going to get a briefing now about monkeypox. This is a phenomenon we've been reporting about. The LGBT Labour is a group, and their parliamentary liaison officer is Joe Vinson. They've been writing to the government calling for more action on monkeypox. Joe Vinson, welcome.
Good afternoon.
What do you think needs to be done that isn't being done?
There's several things that the government need to do to get a grip on monkeypox. And to be clear, without urgent action, we risk monkeypox becoming endemic in the UK. The first thing we need is clear, targeted messaging to those who are at risk of monkeypox. And that is primarily at the moment men who have sex with men, but it can affect anybody at all. It's just circulating through that community at the moment. So far, the government haven't appointed anyone to coordinate the response to monkeypox. That clearly needs to happen. There is a huge need to make sure we get as many people who are at risk vaccinated as possible. Sexual health experts estimate that we need 250,000 vaccines to make sure that 2 doses can go to 125,000 people. But so far, only 50,000. They're estimating that only 50,000 people need to be vaccinated, but sexual health experts disagree with that. And thus far, just under half of the amount of vaccines we need have actually been procured. So we've got to make sure that we get those vaccines into the UK, into the arms of people that need them. But additionally to that, one of the most pressing things is this is putting an enormous pressure on sexual health clinics across the country, and 25% of clinics have so far stopped providing other crucial services to people to prioritise dealing with the monkeypox outbreak. So the government have got to allocate funding to make sure that sexual health clinics can absolutely tackle the monkeypox issue whilst also delivering the vital services they need to deliver.
I had to double check who is the health secretary these days. It has changed a bit over the last month, hasn't it? It's Steve Barclay. Right.
Barclay,
So
right.
You've been in touch with him, and have you had any response directly from him?
So what's happened today is we've taken the rare but very necessary step to join up with the other LGBT groups and the other political parties, so that's the Conservatives, the SNP, the Liberal Democrats and the Greens, to come together and say to the Health Secretary, this is a vitally important issue that he gets a grip on. We've not yet had a response. We sent a letter this morning, but other groups such as the Terence Higgins Trust have been working very hard to make sure the government are in the right place on this. But at the moment, we're just not seeing the action that we need. There's an additional pressure here as well, because those who are found to have monkeypox have to self-isolate for 21 days. Thus far, with no financial support offered to them. So people are facing that very difficult choice between doing the right thing and isolating at home, or making sure they can afford to eat and pay their rent or pay their mortgages. So the government have got to learn the lessons from the COVID pandemic and make sure that the suitable financial support is there for people too.
Is there a hint of sort of coyness about all this, that we're almost back in a sort of parallel world to the AIDS crisis 30, 40 years ago, that people don't want to speak clearly about this subject?
Look, I think there's definitely some of that going on, but we have to be absolutely clear about this. If we do not get the messaging right and make sure that those who are affected or more likely to be affected do not get the right messaging, then we will see monkeypox cases rise in the UK. And importantly, at some point, we may see it jump from the community it's currently affecting, which is men who sleep with men, and into other communities. We shouldn't be afraid. Yeah, but
Joe, that's the point, isn't it? Is it too... Well, I mean, explain why it would be naive for people to say, well, look, my wife, we are heterosexual, I don't have sex with men, it's nothing to do with me, therefore I don't need to worry about this.
I think everybody needs to be concerned about monkeypox. Monkeypox can affect anybody at all. It's not a sexually transmitted infection. It is simply passed on by skin-to-skin contact. Now, at the moment, that is predominantly affecting the community of men who sleep with men, but that doesn't mean it will always stay that way. But regardless, there are people in the UK who need to know that monkeypox is out there, that they need to make sure they're protected, and it's vitally important that we pass that message on to people who at the moment are deemed higher risk than others.
Thanks for explaining it to us, Joe. Joe Vinson there from the LGBT group within the Labour parliamentary. He's the parliamentary liaison officer, I should say, for the LBGT Labour group.